Welcome. Today we're diving into a rare and complex neurological disorder, paraneoplastic cerebellar degeneration, or PCD. This debilitating condition is not directly caused by cancer itself, but rather by the body's immune response to it. Join us as we unravel the mysteries of PCD, exploring its origins, symptoms, and potential treatments. So, what sparks this unusual immune response? Paraneoplastic cerebellar degeneration arises when the body's immune system mistakenly targets healthy cerebellar neurons in the brain. This misdirected attack often occurs in response to cancer cells elsewhere in the body, particularly in the lungs, ovaries, uterus, or Hodgkin's lymphoma. The immune system produces antibodies intended to fight the cancer, but these antibodies react with cerebellar tissue, causing damage. Let's break down the pathophysiology. The process begins with the expression of certain proteins by cancer cells that resemble proteins found in the cerebellum. The immune system, primed to attack these cancer-associated proteins, generates antibodies. These antibodies, such as anti-Hu, or anti-Ri, can then cross the blood-brain barrier and bind to specific cerebellar neurons, primarily Purkinje cells. This binding triggers a cascade of events, including inflammation, cell death, apoptosis, and ultimately, the degeneration of the cerebellum. The loss of Purkinje cells disrupts cerebellar function, leading to the characteristic motor deficits seen in PCD. Paraneoplastic cerebellar degeneration is considered a rare condition. The exact prevalence is difficult to determine due to underdiagnosis and variability in diagnostic criteria. It is most frequently associated with certain types of cancers, particularly gynecological cancers in women and small cell lung cancer in men. While it can occur at any age, it is more common in adults over 50, which is in line with the higher incidence of cancers in this age group. It is crucial to remember that PCD is not a direct result of the cancer spreading to the brain, but an indirect effect mediated by the immune system. The signs and symptoms of PCD can be quite debilitating, affecting movement, balance, and coordination. The most common symptom is progressive cerebellar ataxia, which manifests as unsteadiness while walking, difficulty with fine motor tasks like writing or buttoning clothes, and slurred speech, also known as dysarthria. Patients might also experience nystagmus, which are involuntary rhythmic eye movements, dizziness, and problems with coordination of the limbs. The onset of these symptoms can be rapid, evolving over weeks or months, and can significantly impact a person's quality of life. Diagnosing paraneoplastic cerebellar degeneration can be challenging, as the symptoms overlap with other neurological conditions. The diagnostic process typically involves a thorough neurological examination to assess motor function, balance, and coordination. Brain imaging, such as MRI, may reveal cerebellar atrophy, although this is not always present in the early stages. The most important diagnostic step is the detection of specific paraneoplastic antibodies in the patient's serum or cerebrospinal fluid. These antibodies, such as anti-Hu, anti-Ri, anti-Ter, and others, provide strong evidence of an immune-mediated process triggered by an underlying cancer. It is essential to conduct a thorough search for the primary tumor, even if the patient appears cancer-free. While there aren't distinct types of PCD in the traditional sense, the associated antibody and the type of cancer can influence the clinical presentation and prognosis. For example, anti-Hu antibody-associated PCD is commonly linked to ovarian or breast cancer in women and often presents with severe cerebellar ataxia. Anti-Hu antibody-associated PCD is frequently associated with small cell lung cancer and can involve other parts of the nervous system in addition to the cerebellum. The primary goal of treatment is to address the underlying cancer, as successful treatment of the tumor can sometimes lead to improvement or stabilization of the neurological symptoms. Immunosuppressive therapies, such as corticosteroids, intravenous immunoglobulin (EVIG), and plasma exchange, are often used to dampen the immune response and reduce the attack on the cerebellum. These therapies can provide symptomatic relief, but their effectiveness varies from patient to patient. Physical and occupational therapy play a crucial role in helping patients manage their symptoms, improve their balance and coordination, and maintain their independence. Unfortunately, there are no proven preventative measures for paraneoplastic cerebellar degeneration, as it is triggered by an unpredictable immune response to cancer. However, early detection and treatment of the underlying cancer can potentially reduce the risk or slow the progression of PCD. Therefore, regular cancer screening, particularly for individuals at higher risk, is vital. The prognosis for paraneoplastic cerebellar degeneration is often guarded, as the neurological damage can be irreversible. The severity of the cerebellar dysfunction and the response to treatment are major factors influencing the outcome. Early diagnosis and treatment of the underlying cancer, combined with aggressive immunosuppression, may improve the chances of stabilization or partial recovery. Recent research focuses on identifying novel therapeutic targets and developing more effective immunomodulatory strategies. Furthermore, understanding the specific mechanisms by which antibodies damage cerebellar neurons could pave the way for more targeted and personalized treatments.